Meet Dr. Georgios Papanakalo, a Greek doctor that must have declared he's going to cure cancer in his youth and then took that oath pretty seriously. After all, his work led to the invention of the Pap smear, which has been declared by some experts as the most successful cancer screening technique in the history of medicine.
Cervical cancer, it used to be the most common female cancer in the United States. Now it's not, thanks to the advance of Pap smears and women going to their gynecologists for screening and testing. Now it's almost becoming a thing of the past. The numbers of cervical cancer cases has decreased significantly since about 100 years ago. But worldwide, unfortunately, cervical cancer, it is still the most common cancer women get, especially in developing third world countries. It's a lot more common.
After its widespread inclusion as a preventative screening measure in the 1940s, the incidence of death from invasive cervical cancer decreased by nearly 70% in the United States and other developed countries. The test itself is fairly simple. It involves microscopic examination of cells taken from the cervix. Pap smears should become part of a woman's routine medical checkup within 3 years after becoming sexually active or at age 21, whichever happens first.
And since then, it's gained acceptance as a test that could be applied to the general population for screening, not for diagnosis of cervical cancer, but for a screening. This is a test that's done on every woman, typically about once a year or so. And the new test that's used for cervical cancer screening and detection is the HPV test, the human papillomavirus testing. And we now understand that HPV is the causative agent for cervical cancer. In other words, more than 99% of women who have cervical cancer, they have HPV. But not the other way around. Not all women who have HPV will get cervical cancer. As a matter of fact, most women who get HPV, they can clear it out. It's not a serious thing. But once a woman has HPV, we know to screen her more, to be more careful about her, to test her more, to make sure that she's not getting cervical cancer because she's placed in a high-risk category.
In most cases, an HPV infection doesn't cause any symptoms, so someone may have contracted the virus and not even know it. That's why it's so important for a woman to see their gynecologist regularly to screen and test for HPV and ultimately prevent cervical cancer.
And this is the nice thing about cervical cancer. It gives you a grace period. It gives you a warning period when things are abnormal but not cancerous. If a woman gets help at that stage and those changes are dealt with and it's managed properly, then her reproductive function is intact. She can go on to get pregnant and she doesn't have to worry about getting cervical cancer.
There is an HPV vaccine available that prevents many cases of cervical cancer, but not all, and it could have a significant impact on reducing the incidence of cervical cancer. It's recommended for young women, but now there's a similar HPV vaccine recommended for young men too. So anyone who is interested in the vaccine should speak to their doctor or gynecologist for more information. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.